Traditional Chinese medicine, which acupuncture falls under that umbrella, is a body of medicine that's been practiced for over 2,000 years, and the fact that people are still doing it today in countries as diverse as the United States and all over Europe and all over China, I think it's a testament to the fact that it is a body of medicine that works and is very effective for a lot of different conditions. People primarily associate acupuncture with pain. However, it treats a lot more than just pain. Acupuncture is excellent for pain, but it also can deal with conditions like anxiety and depression and gastrointestinal distress and cancer support for people who are undergoing chemotherapy treatments. It can help with so many conditions, so it's not just for pain. An initial acupuncture visit can last anywhere from an hour and a half to sometimes an hour and 45 minutes, 2 hours, because you're collecting a whole history on the patient. You want to find out not just the symptoms as related to their chief complaint, but you want to find out about everything, about how their GI system's functioning, how their lung system is functioning, how their brain is functioning, because in holistic medicine we see associations and parallels between different symptoms and syndromes that you may see in Western medicine. One thing you will always see done after the question and answer session is pulse diagnosis, where the patient will either be lying or sitting down, and we will take our 3 fingers, our practitioner will take 3 fingers like this and assess the radial pulse, which is right here. And we're assessing not just the speed of the pulse, but we're also assessing the quality of the pulse and how it feels under our fingers. And there's a lot of different manifestations in the pulse that can give us further indication as to what's happening inside the body. And then another thing we'll do too is we'll look at the tongue. So if you could stick your tongue out for me. And by looking at the tongue, I can make assessments based on the color of the tongue, the coating of the tongue, if there's any cracks in the tongues, and that can also give me further indication as to what's happening inside the body. So almost always when I do acupuncture, I'll start with 4 points that have a very circulating effect regardless of what I'm treating. And then from here, then you start to do points in specific areas related to their condition. If it's a chronic condition, I like to leave the needles in for like 20 minutes, maybe even longer if that's possible, 25 minutes. If it's a more acute condition, I have a tendency to leave the needles in for a shorter period of time. Acupuncture stimulates an immune response and stimulates blood flow to go to a particular area to help circulate blood flow. A lot of people who are stressed and tense all the time don't have adequate blood circulation. It actually affects the ability of blood to flow to the extremities. Of course, it doesn't necessarily replace Western medicine, and in certain situations that type of medical approach is absolutely necessary. But it certainly does complement the work that you would receive working with a standard medical doctor.